Waking up multiple times at night to pee, then struggling to fall back asleep, leaves many men over 60 feeling drained, exhausted. I'm Dr. Yvonne Goldstein, a urologist with over 30 years of experience. What you're about to hear is based on deep clinical knowledge of medications used to treat enlarged prostate, or BPH. My goal? Help you choose the best BPH medication with the least side effects, following expert urology guidelines. Here's what we'll cover. Why BPH causes nighttime urination, weak stream, and that feeling of not emptying fully. The 6 alpha blocker drugs, how they differ in effects and risks, how to personalize your medication based on urine flow, leftover urine, blood pressure, sexual function, and fall risk. At the end, I'll share 5 easy steps to prevent nighttime falls. So let me ask you, would you rather sleep through the night or pee with a stronger stream? Have you ever fallen when getting up at night? Part 1. No one should fear the bathroom at 2 a.m. George, 68, told me, I nearly fell getting up to pee one night. Since then, I always leave a light on and walk like I'm afraid the dark might pull me down. He's not alone. Older men often deal with frequent nighttime urination, weak flow, or dribbling after peeing. But what many don't realize is, some medications used to treat this can drop your blood pressure, and that can lead to dizziness and dangerous falls. First, we need to recognize the signs of urinary trouble: low TS, urgency, frequent peeing, weak stream, stopping and starting, or feeling like you're not done. And remember, not all drugs are the same. Our goal is to pick one that works, with fewer side effects, so you can sleep longer and walk safely at night. Safety flag: rise slowly. If you felt dizzy before, tell your doctor. Are you dribbling after peeing? Ever told your doctor about dizziness? Now, let's break down why BPH causes all this. Part 2. Why your prostate causes nighttime peeing and fall risk. When you understand what's happening inside your body, the fear starts to fade. BPH, short for benign prostatic hyperplasia, is common in men over 50. By 80, it's almost universal. Your prostate sits just below the bladder and wraps around the urethra like a donut. As it grows, it squeezes the urethra, like pinching a garden hose. What happens next? Weaker stream, harder to get started, feeling like you're not emptying, and frequent nighttime peeing. Nighttime trips to the bathroom aren't just tiresome. They're dangerous. Getting up in the dark, half awake and standing too quickly, that's a recipe for a fall. Safety flag: use a night light. Wear grip-soled slippers. Don't walk barefoot. CDC, 2022. When you understand this process, we can target the right muscle-relaxing meds and reduce symptoms safely. Is it hard for you to get started when peeing? Ever feel like there's more left after you go? Now let's compare the drug options and figure out which fits you best. Part 3. BPH medications. Don't guess. Follow the data. You might think all BPH meds work the same. They don't. That's why we need real-world research, not gut feeling. A large analysis looked at 22 studies involving nearly 3,000 men, comparing 6 alpha blockers to placebo. This drug class is the most common for BPH with nighttime urination, weak stream, and incomplete emptying. Here's what they found. Tamsulosin and Silodosin are highly selective. They target the prostate directly, with fewer blood pressure effects. Naftopidil, mostly used in Japan, is also fairly selective. Alfuzosin, Doxazosin, and Terazosin act more on blood vessels, increasing risk of low blood pressure. Key indicators like IPSS, symptom score, PVR, post-void urine, Qmax, peak flow rate, clearly showed which drugs performed better. When you know each drug's strengths, you can choose based on what you care most about, a stronger stream or a cleaner emptying. Safety flag. With less selective meds, monitor your BP closely for a few weeks. Avoid driving or sudden movements when starting a new drug. Want stronger flow or better bladder emptying? Next up, let's talk about Tamsulosin, the go-to first choice for many men. Part 4. Tamsulosin, Flomax, the first-line choice. Many men tell me, I just want something to help me stop getting up all night without making me dizzy. In most of those cases, I start with Tamsulosin, or Flomax. It's an alpha blocker, but what makes it special is its selectivity. It acts mostly on the prostate and bladder neck, the main culprits in urinary symptoms. Unlike others that affect blood vessels more broadly, Tamsulosin rarely lowers blood pressure. That makes it safer for men prone to dizziness or postural drops. Common dose, 0.4 milligrams once daily. Studies show it. Clearly lowers symptom score. PSS, improves flow and ease of starting. Qmax, reduces leftover urine. PVR. One patient told me, after 2 weeks on Tamsulosin, I slept 6 hours straight for the first time in years. A small change, but a big deal. Side effects to know. Some men experience retrograde ejaculation, when semen flows backward into the bladder instead of out. It's harmless, doesn't affect climax or fertility, but it can be alarming if no one warns you first. If you've had cataract surgery, tell your doctor. Tamsulosin can cause floppy iris syndrome, making eye surgery harder. Safety flag. Let your doctor know if you've had eye surgery or notice vision changes while on the drug. Have you had cataract surgery? Noticed anything different with ejaculation lately? If, after a few weeks on Tamsulosin, you still have weak flow or incomplete emptying, we can talk about stronger meds. But stronger usually comes with more side effects. Part 5. Silodosin. Strong relief, but be ready to trade off. If your symptoms are severe, constant urgency, very weak stream, always looking for a bathroom, Silodosin might be a powerful option. Like Tamsulosin, Silodosin is a highly selective alpha blocker. It focuses on the prostate and bladder neck, so it has little impact on overall blood pressure. Good for men who get dizzy when standing. What it does well: rapid symptom relief, significant boost in urine flow, Qmax, helps you move around more confidently, without bathroom panic. However, about 1 in 5 men experience ejaculation problems, usually retrograde ejaculation. It's not dangerous, but it can be upsetting, especially if intimacy still matters to you. Safety flag. Tell your doctor if you notice testicular pain, burning urination, or discomfort during sex. Would you rather keep your ejaculation normal or avoid dizziness? If intimacy is a priority, the next option might suit you better. Part 6. Alfuzosin, gentler on sexual function. Some patients tell me straight up, I just can't deal with sexual side effects. If that sounds like you, Alfuzosin may be the better option. It's still an alpha blocker, but less selective than Tamsulosin or Silodosin, meaning it affects both the prostate and blood vessels. Symptom relief is moderate, but ejaculation issues are rare, under 1%. However, Alfuzosin has a higher risk of blood pressure drops and falls, especially in older men. So it's best for those who've never felt dizzy when standing and care more about preserving sexual function. Safety flag. Check your BP lying down and standing up. Avoid alcohol during the first few days. It can make dizziness worse. Have you ever felt faint when standing up? Is intimacy still important to you? If you want both good urination and BP control, the next option might help. Part 7. Doxazosin. Dual benefits, dual risks. I once had a 70-year-old patient say, I pee too much at night, and I have high blood pressure. If there's one pill for both, that's what I want. In cases like that, Doxazosin might be worth considering, with caution. This drug was originally made for high blood pressure, but also improves BPH symptoms, especially leftover urine PVR. Some small studies suggest Doxazosin can also slightly lower cholesterol and HbA1c, good for men with metabolic issues. But it affects blood vessels across the whole body, so it has the highest risk in this group for low blood pressure, dizziness, and falls. At night, getting up to pee can become especially risky. Safety flag. Monitor your BP regularly. Don't increase dosage at night. If you're frail, on many meds, or have fallen before, think twice. I once saw a patient fall twice in 1 month, just from nighttime bathroom trips while on Doxazosin. Do you have handrails near your bed? Night lights already on? Next, let's talk about a gentler option, but you'll need to move slowly. Part 8. Terazosin. Stronger flow, but take it slow. If you've tried Tamsulosin but still feel your stream is weak, or your bladder's not empty, Terazosin could be the next step. It's a less selective alpha blocker, like Doxazosin, but a bit easier on side effects. Studies show Terazosin boosts Qmax, meaning stronger flow. It ranks second only to Tamsulosin in this group. It can also mildly lower blood pressure, useful if you have hypertension. Still, since it affects blood vessels, the risk of dizziness and postural drops remains, especially if you stand up too fast. Safety flag. Start low, go slow. Before getting out of bed, dangle your feet for a minute to let your body adjust. I remember one 75-year-old nearly fell in his bedroom just from getting up too fast on Terazosin. Do you get dizzy in the morning? Is someone around at night if you need help? In the US, this drug is used less often now, but it remains useful in other countries. Part 9. Naftopidil. Depends where you live. If you live in Japan, or have been treated there, you might have heard of Naftopidil. It's a highly selective alpha blocker that targets 1A receptors in the prostate, similar to Tamsulosin, but more focused on urination than blood pressure. Small studies in Japan show Naftopidil helps lower symptom scores IPSS, reduce leftover urine PVR, and possibly support erectile function in some men. But this drug isn't available in the US safety flag. Don't order meds online or from overseas. Always talk to your doctor before trying foreign medications. Which state do you live in? Have family bringing back meds from Japan. If you have both BPH and erectile issues, there's still another US-approved option. Part 10. Tadalafil 5 mg daily. 1 pill, 2 problems. If you're dealing with both ED and urinary symptoms, there's one simple option you may not know about. Tadalafil 5 mg daily, brand name Cialis, low dose, has been shown to improve both ED and BPH symptoms. At this dose, you only need 1 pill a day, instead of juggling 2 separate meds. If your ED meds are already working, you can still consider adding an alpha blocker if urination hasn't improved. The benefit: simplifies your routine, boosts your quality of life. But Tadalafil must never be taken with nitrates, common meds for chest pain. Safety flag: tell your doctor if you have heart disease, use nitroglycerin, or often have low BP. AUA 2023. Are you on heart meds? Had chest pain recently? No matter which medication you choose. Safety always comes first. Part 11. Warning: preventing falls. Matters just as much as peeing easier. Many men only care about peeing better, but don't realize the very meds they take might cause a fall. All alpha blockers, though effective, carry one hidden risk: postural hypotension. This can cause dizziness when standing up quickly, fainting, and worst of all, nighttime falls, especially when walking in the dark to the bathroom. Some meds like Doxazosin and Alfuzosin carry a higher fall risk. Tamsulosin and Silodosin are generally safer in this respect. Safety flag: check your blood pressure lying, sitting, and standing, especially after starting or switching meds. Avoid alcohol when beginning treatment. Install night lights, remove loose rugs, and tell your doctor if you've ever fainted, even once. CDC 2022. Got any tripping rugs at home? Do you have grab bars in the bathroom? No one-size-fits-all pill exists, so the right choice depends on your body and needs. Part 12. Personalization. The best plan is the one that fits you. There's no single pill that works for every man. Each body, each priority, each condition is unique. If you want uninterrupted sleep with minimal dizziness, Tamsulosin is often the first choice. If symptoms are severe, urgency, weak stream, frequent trips, Silodosin may help, but could affect ejaculation. If preserving intimacy matters most, Alfuzosin is worth a look, but watch your blood pressure. If you've got BPH and high blood pressure, Doxazosin or Terazosin offer dual benefits, but with increased fall risk. The best step? Review all your current meds, other conditions, and your personal treatment goals. Safety flag: each time you adjust your dose, check your BP. Reassess fall risk in 2 to 4 weeks. A UA 2023. What's your number one goal? What are you willing to trade off? And what's non-negotiable? Now, let me share a few real stories. You might just see yourself in one of them. Part 13. Patient stories. Each man, a different choice. Here are a few real examples. Men like you, facing the same decisions, but each choosing his own path. Harold, 68, started with Tamsulosin. He used to get up 5 times a night. Now it's just 2. For the first time in years, he sleeps 6 hours straight. Walter, 73, chose Silodosin for stronger relief. His stream improved dramatically, but he had retrograde ejaculation. It took time to accept. Raymond, 70, went with Alfuzosin. His symptoms eased, he had less dizziness, and he kept his intimate life intact. Gerald used Doxazosin to manage both BPH and high BP, but he fell twice at night and had to install grab bars and night lights. Barton Lewis, 75, tried Terazosin. His stream got stronger, but he felt lightheaded every time he stood up. Barton Jenkins, 81, stayed on high-dose Doxazosin without rechecks. One night, at 2 a.m., he fell and hit his head. Safety flag. If you've ever fallen, prioritize selective meds and reassess your fall risk as soon as possible. Who do you relate to most? Harold, Raymond, or Jenkins? Ever had a nighttime fall? Let's wrap this up with clear, actionable steps. Part 14. Next step. You deserve restful sleep and a safe life. I know all the choices can feel overwhelming, but you're not alone. And with the right info, you can make the right decision. Today, Tamsulosin 0.4 milligrams remains a common first-line choice, effective and fairly safe. But no drug fits everyone. We need to look at weak stream or stop-start flow, high PVR, blood pressure, ejaculation, or fall issues. Here's your next step. List all your current medications. Track symptoms, dizziness, fatigue, ejaculation changes. Ask your doctor, is this still the safest choice for my age and health? Safety flag. If you have urinary retention, blood in urine, fever, or severe back pain, seek care right away. NIH/NIDK, 2023. Are you ready to talk openly with your doctor? What's your current top priority? Next, a bonus. 5 small steps that can make a big difference. Bonus. 5 steps to prevent nighttime falls. Simple but powerful. Falls aren't just a part of aging. They're preventable. Here are 5 small but powerful actions to reduce your fall risk at night. Install motion lights or night lights along the path to your bathroom. Add grab bars near your bed and in the bathroom. Clear throw rugs, cords, and floor clutter. Sit for 1 minute with feet down before standing up. Let your blood catch up. Wear grip-soled slippers. Don't walk barefoot. Safety flag. If you've ever fallen, ask your doctor for a fall risk assessment. CDC, 2022. Do you already have night lights at home? Which step will you try first tomorrow? Part 15. Putting it all into action. Body. Manage BPH symptoms with Tamsulosin or another drug that fits your needs and BP profile. Mind. Sleep better without fear of falling. Habits. Install night lights. Rise slowly. Check BP with any med change. CDC, 2022. If your current med isn't working, ask your doctor. This one doesn't feel right. Can we talk about other options? Disclaimer. This video is for informational purposes only. It does not replace diagnosis or prescriptions. If you have warning signs, contact a health provider. NIH/NIDDK, 2023. See you next time, and may you sleep through the night safely.